Welcome back again to this next session of the Australian Apitherapy Association. Yesterday, we met the noted German apitherapist, Dr. Thomas Gloger, who gave us a presentation on treating arthritis with live bee stings, which is very effective treatment. Today, Dr. Gloger is back to give us another presentation on treating wounds with honey. Welcome back, Dr. Thomas Gloger from Germany, and we'll now look at your presentation. Thank you.
My dear friends of apitherapy in Australia, here another contribution which I'm happy to give for your Australian Apitherapy conference. I want to speak about integrative treatments of wound with honey and other apitherapy methods. So I want to detract your view from honey that you can honey only eat. There are other things which you can do with honey. Quick look on my person. Here I do some probing for American foul brews at home, and here 2017 for the apitherapy session on Apimondia in Turkey. Another invitation in Turkey for a big conference. Turkey is a big research country for apitherapy. And then Slovenia, that is the heart of the bee. Slovenia sends her Ministry of Agriculture, which stands besides me, to Canada to show to the big Apimondia show. And also on the day of the bee is here the state's president of Slovenia, who starts this whole session. It was incredible 3 years ago about, and you see, we have to show as beekeepers and apitherapists what we can do and achieve. So I have written a book. It's also available in English about apitherapy. You can order this. We can send it to Australia by ordinary postage, so that should work. You have to be a little bit patient, but it is possible. Let's go on the use of honey in history. So we see something from the Sumerians 2,000 years ago, BC Christos, as wound dressing in Codex Hammurabi. There are already medical information about that. Though the Bible, the Quran mention that. Plinius the Elder and Galenus are more precise and have also some descriptions. Alexander the Great is transported in honey. The dead Alexander the Great and his soldiers were treated with honey. So he was brought to Egypt in honey. So it was used in humans and in livestock. So when we look on treatment among Greeks and Romans, then we see honey is mixed with wine, oil, vinegar, other things. It's often cooked. We can see so much to the real procedures, and it's difficult to understand how they did it at that time. And the homeostasis is sometimes done with an annealing iron. So we have to be careful what they really did at that time. But in modern times, we have since Kneipp, since 1915, some successful approaches. Mass applications come during the First and Second World War, especially in Russia, due to the mass of injured people, and they had to treat, and they got some experience on that. The research was done between the world wars. It was description of flushing out of bacteria from wounds, less secondary infections, faster healing, development aid. It's used in third world countries. The book here, where there is no doctor, mention it. So it's not an unknown method. So the scientific recognition comes 1999 with Peter Molan in New Zealand. So he had the luck to be very far away from the centers of pharmaceutical industry, so he had time to describe what are the activities of honey. So he's first anti-inflammatory, he is antibacterial, and the debridement of necrotic and non-valuable tissue is that comes out, reduction of unpleasant smell, and the stimulation of the tissue regeneration. So this is the scientific work of Peter Molen, who really got it into a different stage, that he described the single actions of honey. So when we look on honey in general, we see, or when we look on the skin and see the pH, so as acidic, then we see here the stomach is extremely acidic, so like Coca-Cola, but also here the where we have when we're sweating here, it's very it's quite acidic, and of course our intestinal our inside the earwax and the intimate zones are very acidic, and they are as acidic as the honey. So that is really interesting, that we have here an ideal smooth skin stuff, which has an identical physiological properties in the pH. And we know pH, the more acidic something is, the less bacteria can grow. We see that here from the stomach. We know it from sauerkraut, we know it from yogurt and other preservative techniques. So honey is acidic, and our skin is also acidic, including some other parts of our body where it's really beneficial to have honey if there are wounds or other problems. So in honey are defensins, they are oligopeptides, small 12 to 100 amino acids, so they are non-specific immune defense. They destroy the membranes of bacteria, fungi, virus. They are partially antiparasitic, which is also interesting. Stimulation of phagocytosis, stimulation of neovascularization. One example you know very well is melittin from bee venom, but there are different ones also in honey. So B-defensin, royal xylene is also known in royal jelly. So it's a kind of external immune system. So the main power of honey is the hydrogen peroxide. It's formated by glucose oxidase. Hydrogen peroxide was used till the late 70s to clean wounds, 3% hydrogen peroxide. But this was very strong, too strong. So this kind of technique was stopped, and it got also forgotten. I think only all the nurses know it, all the doctors know that. So people from my generation, maybe you know it. But the hydrogen peroxide formation in honey is low. So that means that there is enough to kill the bacteria, but not so much that the wound is destroyed. So, and the glucose oxidase gets more active as soon as the honey is diluted. So when you have honey on a wound and there is some water, some exudate from the wound, so you don't have to be afraid that the honey doesn't work anymore. It's the opposite. In a certain range of concentration, honey works more, or at least the glucose oxidase works more, and meaning produces more hydrogen peroxide, meaning that there is less bacteria infection possible. So it's constantly replicated, so it's always a low dose, but that is enough to stop the multiplication of bacteria. And they were killed with the radical, the oxygen or the hydrogen oxygen radical. So Then we have migration of ingredients. We have in the honey a lot of stuff which can penetrate into the skin. We know this from the honey massage. Honey massage, we put 2 spoons of honey distributed on the back, and the honey is disappearing in the back. And the same is, of course, happening in a wound. So the local energy supply is done by the glucose and the other sugars of the honey. So it's a compensation of nutrient deficiencies in the wound. For example, the amino acids, and so it's a complete resorption of in the wound. So the local area of the wound is suddenly good supplied with energy. This is one of the secrets. So one of the side effects is that the wound bacteria turn from protein digestion to sugars. So the meaning, if the wound is infected with some bacteria which make a bad smell, they stop to digest the debridement, but they use the sugar of the honey. And in 1 or 2 days, or mostly only in 1 day, the bad smell is stopping by the honey addition, and of course makes it for these bacteria more difficult to survive in the wound. So yeah, we talk about Peter Molan in New Zealand, and of course he took the honey which was available there and known for its antibacterialness was the Manuka honey. So the word Manuka is a little bit different for Slovenians. When they hear Manuka, they cannot sleep. And what they did is they make a comparison study with other honey, so chestnut honey, fir, flower, linden, forest, oilseed rape, acacia, Manuka, and of course against Manuka. And you see already here the biological name Leptospermium, and there are also species of Manuka in Australia, as you probably know. So when we look here on these bacteria, we have Escherichia coli, Staphylococcus aureus, and also these smelling bacteria here, the Venosa. You see that when we compare the different honeys, then we see that it's quite similar. It's only the forest honey, which is not blossom derived, is a little bit different in its mode of actions. But most of the honeys have nearly the same kind of inhibition of bacteria. Okay, the chestnut honey is a little bit superior. So, and here is a more detailed study, also from Slovenia, for mouse bacteria. And here you see it's also benchmarked against Manuka honey. And you see that here there's different, it's not wound bacteria, but mouse bacteria. But you see here that again, we have not much of difference. So the Manuka honey, is unique because of its content of methyl glyoxyl, and the formation is done during 1 year storage. So from a chemical intermediate of the honey, and the MGO is heat stable. This is one of the secrets why you can treat the Manuka honey later with irradiation. So yeah, I already mentioned the leptospermium types, which are also present in Australia, which have even higher values of MGO. So the contents are 50 to 1,300 milligrams, and mostly the Australian jellybush honey reaches that. So this takes over, this MGO takes over the action of hydrogen peroxide. So they are, so in other floral honeys, there is also MGO found, but in much lesser values, 0.3 to 3 milligrams. Thyme honey has a little bit more with 15 milligrams. So the hydrogen peroxide is hardly contained because the MGO inhibits the glucose oxidase. So, and yeah, that's you see there are different ways of mechanics of action. So there is a concern that people who have diabetes cannot use honey in wounds, but this is you don't have to be afraid of this. As I said, the wound is nourishing the wound and the bacteria, so it's action very locally, so it doesn't go really into the patient, so it has no influence on the blood sugar if you put even on big areas some honey. So and internally, so of course we had here on our Apitherapy Congress a nice presentation just for honey and diabetes, and it's very important that diabetic people eat honey because the honey reduces the blood sugar and the antioxidants reduce a lot of the side effects of diabetes. So, for example, vascular protection and so on. So it's a different universe on its own. So we have bandages with honey on wounds. Is the honey doesn't stick on the wound, so that is nice, or that the bandage is not sticking on the wound. So the honey is hygroscopic and absorbs fluid out of the wound, so it grabs the water away, and the bacteria who need water, they are more or less dried out. So, but in the end, the bacteria dried out, but not the wound is dried out. So the wound is always wet, and this helps the healing. So you probably know it yourself, as soon as wounds are dried out, they do not heal anymore. So it supports the wound bed, and it buffers an excessive immune reaction. So the kind that there is less scar tissue formed by the wound. So in the point with MGO is that it's often associated with pain in the wound. So that depends, but the truth is some people, they are sensitive to the methyl glyoxal and some are not. So you have to try, and if one of the honeys doesn't work, don't throw the honey away, take another honey. So that is again the advantage of natural thing. If you have, if Manuka honey doesn't work or jellybush honey doesn't work, take a floral honey, or the other way around. So we have to be fair and see that the things are not black and white. So what we have here in Europe is the commercial medical honey. It's chestnut honey from the company Tosama. It's special sterilized, and it's mildly sterilized, so it's still honey. Whereas the medical honey we have with Manuka honey is treated with high doses of gamma irradiation, and that means that the enzymes are destroyed. And when you look on the regulation of honey, the definition of honey, then that doesn't comply anymore with honey. But this honey still complies with the EU regulation for honey. So you can put that on your bread for breakfast, and it's still chestnut honey. It's a little bit expensive, to be honest. So there are guidelines. When you have questions to that, look on the Tosama website, and there you find a lot of additive stuff that helps you when you want to use honey as a wound dressing. So there are now adapted products with alginate and with polyurethane foam, but all products are based on chestnut honey. For example, this is a mesh with honey, and can just easily put on the wound. So when you have a wound, then you clean the wound, you dry the wound, and then you put the honey on the bandage. That is very important, that you put it on the bandage, and then put the plaster or the bandage on the wound. So this is the less pain inducing stuff procedure how you can do it. So here's some examples. You see a bike rider was a little bit too fast and fell here, had also a broken bone, and you see within 10 days, no, 20 days, it lasts always some time, it looks quite nice, and here within 6 weeks it was closed, and this was natural honey, no medical honey. Here a funny story from Switzerland. It's burn 2 and 3rd grade burns. The guy got to the hospital because he got a cut, and when he got home, he waited at the bus stop. Even Switzerland is big, so he had to wait for 3/4 of an hour, and he took a cigarette, and by lighting the cigarette, he inflamed the bandage, so the bandage was glowing. When he was back in the village, he came back to Matthias, the doctor from whom I have this picture. He said, it's so painful, and he opened the bandage and he saw that it's glowing under sun. So they treated it with honey, and in this case it was medical honey. So you see and you see here the time. It's here beginning of October and 2 months later, and so the healing time is quite substantial. But when you see here that are burns 2nd grade, even 3rd grade, it's very heavy, and you have here no scars. You have a little, you're missing the pigmentation, but you have no scars. And Matthias says, if you close your eyes and go with the finger over this closed wound, you cannot feel a difference in the texture. So this is very, very nice, very beautiful, and over a couple of years, the wound will be like the other skin, and you already see here the new skin is fractural, so no scars tissue. So then we have here a more commercial wound, something diabetes patient, venous ulcers on both legs, heart insufficiency, and it's with Pseudomonas aeruginosa infected. The guy I already mentioned, she was in the hospital, got 2 weeks already, intravenous, some antibiotics, but it didn't work. So, and you see here it's biofilm on it. It's really ugly. It's something where the doctors find nice because they can do amputation, and they start with 1 toe, 2nd, 3rd, and then cut 5, 6, 7 times over a couple of years, and it doesn't get under control. And one of the reasons is here this biofilm, and the honey destroys this biofilm. In this case, it was the chestnut honey. And you see also that it lasts time, it's 5 months. And one of the reasons is that she is old, the healing power is not very good. There are other illnesses which have sometimes more priority to treat. So heart insufficiency means that they can have a heart attack in between. And then this kind of wound is secondary and doesn't get this treat this priority treatment. Here we have an easier wound from Tusama, Grace, and we see here within 3 days it's nicely treated. But yeah, you see what you can do at home. This is not something where you need a doctor. You would today probably put iodine on it, try with small wounds, and you get more get experience and grow it, and then you see you can go to bigger wounds over the time. That is how we treat our children. We treated them many years. And here we have again a case study from Tusama, and this is duration of the ulcer, 12 years, wound area 17 centimeters, and yeah, it's score 9, and then its wound dressing will be changed every 3 to 4 days. And again, venous ulcers, and I think what I see here is this polyurethane foam, which takes the liquid from the venous ulcers. And here you see it then after 12 dressing changes, 42 days, which is 6 weeks. And reduced, when you look here, it's 17, here's 15. It's only 2 centimeters, but it's square, so it's reduced by over 20%. And the pass score is only 7. And you see here these biofilm infections, and this you don't see here. It looks much better. So you see a big difference when you treat honey. And you can also imagine that in this case, doctors do not want to make compromise and take your honey, but this is always, when you do it yourself, you can do everything. There is nobody there, but as soon as medical personnel in Europe is involved, they have to be on the safe side, and they use medical products. And the good thing is we have already this nice medical products approved according to EU directive. So some practical tips. Medical honey is for large wounds, for elderly and immunosuppressed patients, deep wounds, especially when there can be anaerobic areas. So when there is some pockets somewhere in the medical field. Also, veterinary medicine is very recommendable. Beekeepers' honey is all in the private area. It's under your own responsibility, as long as, from my point of view, a manageable size. It's for healthy patients, and other apitherapy things are important, as propolis, so wound aftercare, propolis tincture or ointment. So, and here now that what I wanted to say as holistic, and here you see again a comparison of a burn from an oven. The lady burned her arm, and she immediately put some fresh royal jelly on it and on top honey. And you see how nicely there's only a light shadow which you can see, but no scar. Also, this is a really bad wound. So, and she is a small lady, so that is a real deep wound for her. And you see how you can combine things in apitherapy and are more successful. So yeah, the problem is we focusing in traditional medicine on the wound, so it detracts our view from the general health problems, as I showed this lady with the heart problems. So the people have mostly diabetes, they have cancer, they are dement, they have chronic diseases. We ignoring the immune system. So we need the immune system as self-healing. So improvement of the mood and motivation. So when you cannot go out because of such big wounds, you get into depression, and that doesn't help the wound healing. Yeah, we need also the restoring of the body function. So the holistic view means chronic wounds expression of serious is an expression of serious disease. Diabetes, we have Sneddon syndrome very seldom, which here our Swiss doctor treated acute wounds, so gate opener for bacteria and viruses. So even if you are healthy and have a big wound, you have to be really careful what kind of guy is coming into this wound and absorbs the capacity of the immune system. And I hope you now see what the holistic view, and you see here the holistic viewer, and he sits here. And yeah, that's important, I think, for my message, not only to focus on the wound. So we have the Propolis, it's anti-parasitic, it's antibacterial, anti-cancer, anti-autoimmune diseases, immune modulatory. So, and therefore we have to also take Propolis for the inside. And here we have a very nice example of Michael, our Brazilian friend for wound healing. Again, a diabetic wound, very big. Normally the leg should be amputated, and very, very ugly, very bad. The lady is dement, over 70 years, and after 7 months it's like this. And yeah, they did the following. They gave royal jelly daily, 100 milligrams. Also, I would now take much more, 2 grams a day. Royal honey in the evening, 1 teaspoon at least. Green propolis. Yes, it's low dose for can be much higher. Pollen 1 teaspoon, and bee stings per week. So 18 bee stings around. And then they took a number of other globally and anthroposophical medicine. So it was a long ago. So you saw 7 months. But you see, the main thing is here, the green propolis, royal jelly, a little bit of honey, eventually some pollen, and the bee stings around the wound, they activates the wound. That's very important, a very interesting thing. Bee stings as antibacterial immune pushing action. So, and she had here no wound after 7 months and no hypoglycemia. So the diabetes was also under control. So that is something which you have to have on your viewpoint, that you do not focus only on the wound. So here we see this wound activation with micro stings, and we go here around, and here wound means scar. So here we have a wound at the side, and you see the foot gets inflated by the liquor, which is queuing up at this barrier here. And so the wound, it was an operation, of course, destruction of the lymphatic lines. And honey helps that there is less exuberant tissue, as I already mentioned. And bee venom on the scar means scar treatment. So the scar here was treated with bee venom, and then the liquor of the lymphatic system could run quicker. So the conclusion: with honey, wounds are healing better and quicker. But with apitherapy, we can do even more. So propolis, green, red, brown, 2 to 8 grams a day. Royal jelly, 2 grams a day. Eventually, apilamil, 1 gram a day. Pollen, 1 teaspoon. Bee venom, depending, of course, on the person, but also activating, and also antibacterial, antiviral, very important. Honey, 1 tablespoon. So the mechanism is strong, enhancing the healing with these other methods. Antibacterial, antiviral, strengthening the immune system. That is what you always have to get in your mind when you are ill. You get the yellow card from the universe, and if you ignore it, you get the red card, and then you get cancer, and it's even worse. So you're strengthening the will. You want to become healthy again. You have to fight the oxidative stress, and it must be synergistic with other procedures in medicine. So don't be too shy to just use it, and don't tell the doctor too much. Just propolis is synergistic with antibiotics. Antibiotics are sometimes 100 times more effective when you take propolis at the same time. So, and of course, it's up to you to leave the antibiotics away. Let's see. So you can read a lot more in my book. It's The Power of the Bee. You see here the number. You can write me an email also if there are some questions. Here is my coordinates. We are in Germany. We make teachings and trainings for apitherapy. So here, whoever wants to know much more about bee sting therapy and other things, you can ask me all the time. So I'm now open for questions. I don't know how the Congress is organized now. If there are more questions or more personal questions, write me an email and come into contact, or hear this number. This 157 is also a WhatsApp number, so you can easily contact me. And yeah, I wish the Congress and the organizers a further very good prospect, and thank you for listening.
Thank you so much, Dr. Gloger, for your excellent presentation on treating wounds with honey. We do have some questions. The first question we have is, honeys with high glucose can crystallize easily. Are they the best honeys for wound healing? You need to unmute yourself, sorry.
Yes.
Can you unmute? Oh, there you go.
Now it's better. So yes, you should of course use a liquefied honey or liquid honey. So the darker the honey, the better. At least for our area. If you have crystals in the honey, you always have to bear in mind that they can cause injuries in the wound. So when you have crystallized honey, take one with very small crystals. Of course, they solute more or later in the liquor of the wound. But if they are really sharp, they make more injuries then.
Also, could you tell us how the honey is sterilized in Germany? We've had that question.
Yeah, this special honey, is from Slovenia, and they using beta rays. So that's a mild radiation. So the enzymes were not killed. So the other honeys often they use gamma at high dose, so that where you also use, for example, for pepper or these things, and this kills really the enzymes, which doesn't make which isn't bad because the MGO is there working, but in this case we want to conserve the enzymes.
Also, we have a question: can high lactobacillus honey help in internal bacterial infection?
Oh, that's interesting. Is there lactobacillus honey?
We've just had that question. So there must be, I think it's from a very experienced beekeeper, so there must be.
I just yesterday wrote the question, so that do women have more lactobacilli in their breast when they have cancer or not? So, and of course, they who have more lactobacilli in their breast, they have less breast cancer. And lactobacillus is something which does very good for us everywhere, in our ears, in all the holes, on our skin, in ourself. So when you have this kind of honey, when you have access to this kind of honey, then I would always prefer this kind of honey.
Can you tell me, do you have much resistance from mainstream medical professionals about your treatments of wounds with honey? Do you have people criticizing you, saying you shouldn't do this, it's risky, or is it more accepted in Germany?
it's not mainstream. So the advantage is this: the Slovenians had registered this honey under EU law, so it's a medical device. So you, when you have the power and go into the hospital and tell the doctor, look, you make an operation, you have two possibilities: either you take my honey or you take this honey. That gives them a choice. The problem is that the doctors today throw you out of the hospital and say, go away. I don't treat you with these obscure things. The point I'm always making on beekeeping congresses is that we are in Germany 125,000 beekeepers, and with family, this is nearly 500,000 people with an age over 50. So people who normally then tend to go in the next 10 years at least once in a hospital. And when every year 500,000 people or 100,000 people go there and ask the doctors, then there will be at least some doctors who will say, okay, I will simply try it. And because even there in this medicine, people are they are very good people, and then they will see how it works. So, and it's more something from the beekeepers. We have to pressure that it is used, because it's legal. And of course, we can use our honey at home, but as soon as, for example, you have some relatives, they were treated by some services, elderly, when you have parents or some, and they have these wounds, the services say, sorry, it's your honey, I'm not allowed to use it. But with this kind of honey, you are out of this legal question. And this is, let's say, the first step. Of course, we have to go much more steps in this journey.
So what would your advice be to Australian beekeepers about the prospect of using their honey for this medicinal purpose? What would your advice be to them to start being able to offer it?
You mean really as selling as a product?
Mm.
Okay, because I think the first thing is you convince yourself. And we started very small. So I took very small wounds, for example, I cut in the kitchen with the knife, and the deeper the wound, the better honey works. And then overnight, suddenly the wound closes when it normally doesn't. So, and then you get used to that and say, okay, when it works for a small wound, then I take a bigger one and a bigger one. Of course, hopefully you don't have so many chances to use it, and you hope you're not cutting yourself so often in the kitchen. But with children, you always have these problems that they come home and they're bleeding, and you think, okay, that's nothing for the hospital, but it's still serious, and do it properly. So try there, start it, and then for Australia is try to get registered as a medical device, like a bandage. So I don't know, I didn't follow this talk about your medical your legal system, but I think this is the way. I'm convinced that honey doesn't have to be sterilized. If you work properly, have good practices, and you have not really these pockets, I said, deep wounds, very old people, you can use your honey. But the thinking of today's medicine is there must be nothing in it, no bacteria, nothing, not a single one. And okay, then to go this is probably one step we have to go, or what is it? A compromise, let's say, a compromise, find a mild procedure. You have a lot of mining holes deep in the, and you can do their beta arraying. That's not rocket science, and do it. And then go on the market, and there is a lot of diabetic wounds. I think the elderly people, it's very, very common, and they suffer a lot. And The only thing, you don't see the people because they cannot move around anymore. But they are there, and there is let's say a big market. So I don't want to talk about these things, but there is a real practical need.
Dr. Thomas Gloger, thank you again for your very generous time, for staying up, I'm guessing, very late in Germany to speak with us again. We're very, very honoured to have you with your powerful presentations, and we look forward to helping people access your beautiful book. And please send us more information about it so people can see it on our Australian Apitherapy Association website. And congratulations on your work, and thank you again for supporting our conference.
Yeah, thank you for organizing that, to bring these things everywhere and make it available.
We think it's well overdue. We think it's well overdue for people in Australia to be exposed to the sort of work that you do.
Great, great.
Thank you. Goodbye. Good night. Good evening.
Yes, thank you.
Good morning. Thank you. Bye-bye.